Thank you, Madam Secretary. I frankly have to leave this instant, take a phone call right back, but Senator Hatch, why don't you take over? And I'll be right back.
Secretary Sebelius, I am curious as to how your department is funding overall efforts under the health law now that much of the initial funding has been depleted. A quick review of the HHS budget in brief seems to suggest that you are diverting funds from other areas of the department to put towards implementation. Some estimates estimate as much as $500 million might be moved from other portions of the budget. Would you describe the authority under which you believe you have the ability to conduct such transfers, and whether or not you believe that Congress should be notified when these transfers occur?
Senator, we did request additional funding with the continuing resolution in 2013, and we're not given additional resources by the United States Congress, although we have the duty to implement the law. So I have, for 2013, used both my transfer authority, which is statutorily in our budget, as well as the non-recurring expense fund for one-time IT costs, and a portion of funding for the prevention fund to use for outreach and education. You heard Chairman Bacchus describe the level of concern and questions in states around the country, and we want to make sure that Americans fully understand the benefits that are coming their way and the decisions that they can make. We have requested in the budget that's before you, in the 2014 budget, an additional $1.5 billion to fully implement the Affordable Care Act.
Okay, well, federal Medicaid spending as a percentage of the economy, according to the budget, will increase by 25% over the next decade, driven by the Affordable Care Act expansions and long-term care spending. Now, that's more than $4 trillion over the next decade. And that's not even counting the trillions of dollars states will spend on Medicaid. According to the National Governors Association, quote, Medicaid represents the single largest portion of total state spending, unquote. Now, Madam Secretary, this budget backs off of prior proposals to lower spending on Medicaid, such as the blended FMAP rate and provider tax reductions. Now, this is especially discouraging since there are bipartisan proposals that would have achieved significant Medicaid savings and improved patient care. In fact, your predecessor under President Clinton, Secretary of Health and Human Services Donna Shalala, said that Medicaid per capita caps mean, quote, there are absolutely no incentives for states to deny coverage to a needy individual or to a family. It is a sensible way to make sure that people who need Medicaid are able to receive it, unquote. Now, unfortunately, your fiscal year 2014 budget only proposes to save 0.5% in Medicaid, and it lacks any serious reforms to the Medicaid program. Now, my question would be, why does your budget completely fail to address one of the country's fundamental, most serious challenges?
Well, Senator Hatch, I think there is a very positive story to tell about Medicaid. And believe me, as a former governor, I am dealing with my former colleagues and the CEOs of states around the country each and every day. Medicaid spending last year, between 2011 and 2012, actually decreased by almost 2% per beneficiary. Decreased by 2%. That's virtually unheard of. And we are engaged in a series of what I would call very innovative strategies around the dual eligible population, often those individuals who you have just referred to in nursing homes, around progress on reforming high quality, lower cost Medicaid healthcare delivery, working with states who are engaged in just exactly what states do the best, which is very innovative strategies looking at their overall healthcare spending. So I think that the Medicaid story is one that is enormously positive, where governors are very much engaged, and we've been very pleased at the number of governors who are interested in expanding their Medicaid population and providing health benefits for some of the lowest income workers in a very cost-effective strategy.
Would you be open to work with us on bipartisan ideas to improve patient care and of course save money in the Medicaid program?
I'd be happy to work with you and others on that.
Well, thank you so much. Thank you, Mr. Chairman.
Thank you, Senator. Thank you, Senator. As you somewhat know, Madam Secretary, I'm a bit Johnny One Note on implementation of the law, especially with respect to sign-ups and exchanges, etc., and very concerned that not enough is being done so far. Very concerned. When I'm home, small businesses have no idea what to do, what to expect. They don't know what affordability rules are. They don't know what penalties may apply. They just don't know. I mean, I was talking to one CPA, you know, he's not histrionic. He just been straight with me. He said, Max, I just got to tell you that, you know, my clients, small business people, are just throwing their hands up, and I don't know what to tell them. That's just from a small business perspective, let alone all the other issues that are going to be arising here. And people, as I discussed earlier, and as you well know, a lot of people have no idea about all of this. People just don't know a lot about it. And the Kaiser poll pointed that out. I understand you've hired a contractor. I'm just worried that that's going to be money down the drain, because contractors like to make money more than they do like to do anything else. That's their job. They got to worry about their shareholders and whatnot, and also the other agencies are all involved. People are going to be really confused, and maybe you give some thought to a one-stop shopping somehow. So you go to one location, a business person, one location, you get the answers. I just tell you, I just see a huge train wreck coming down, and you and I have discussed this many times, and I don't see any results yet. What can you do to help all these people around the country? What in the world do I do, and what do I know what to do?
Well, Mr. Chairman, as you know, and we have had these discussions a number of times, we certainly take outreach and education very, very seriously. It's one of the reasons that I think we were incredibly disappointed that our requests for additional outreach and education resources were not made available in the CR of 2013. Having said that, we have engaged in efforts with the Small Business Administration, who is doing regular meetings around the country with our regional personnel. We have just released a request for proposal for on-the-ground navigators, individuals who come out of the faith community, out of the business community, out of the patient community, out of the hospital community, who will be available to answer questions, walk people through scenarios, hold seminars. We do regular seminars and webinars, but we also understand that people have a lot of questions, and are deploying as many resources as we can to answer those questions and get folks ready to engage in open enrollment on October 1st.
Well, you have benchmarks. You got dates by which a certain number of people know what's going on. I mean, all these polls, for example, show that we're not making much headway. Do you have a goal that 2 months or 30 days from now, and that same poll is taken, that percentage is down by X percent, and 60 days from now it's down by X, that people know where to go and what to do? Are you surveying the accountants profession, work with businesses, and get a certain percent that or feel confident? I mean, you need data. And do you have any data? You've never given me any data. You just give me concepts, frankly. And government's not a business, but you're going to have some data, benchmarks to figure out what progress you are or not making.
Well, we do not have benchmarks for how many people know what. We don't intend to do polling and testing in terms of what people know. We do have some very specific benchmarks around open enrollment, and we have a campaign and a plan to lead up to open enrollment.
Now, what is it? The campaign and the plan?
Well, Mr. Chairman, as we have discussed, there will be people on the ground starting this summer.
How many?
Will be, I can't tell you at this point.
At what point in the summer? Geographically, what states? That's the kind of information I'm asking for. You're only going to be able to do a decent job if you know the answers to these questions.
Yes, sir. And I'd be happy to give you all of these specifics. As I said, we just put out the request for proposal. I can't tell you about the numbers because we don't have the information back yet about how many people in which states are going to be actively engaged on the ground, but I will be happy to share that with you as we move forward.
It depends upon states that have exchanges and those that don't. And there's just a lot of factors here.
We will be focusing, the request for proposal for navigators at this point is on the states where the federal marketplaces will be in place.
What's a navigator?
A navigator is going to be an individual who will go through training and be available to help educate individuals or groups of people.
How many Americans know what a navigator is?
Pardon me?
How many Americans do you think know what a navigator is?
I have no idea.
I'll bet you well, we have two here. Okay, you can understand my angst. I'm going to keep on this until I feel a lot better about it. Thank you. Next, Senator Nelson.